In this episode, you will learn how to prepare the wound to get the best from the treatment decided in the treatment plan. When you manage a chronic wound, it is important to prevent complications and create an optimal environment to help the wound heal. That is why effective preparation of the wound bed, wound edge, and peri-wound skin is key in achieving these goals. Today you will learn: why is effective wound preparation so important? What are the main elements of wound preparation? When should I perform wound preparation? Wound preparation is an essential part of wound care. Did you know that what is removed from the wound is often more important than what is applied to the wound in terms of dressing selection? Wound preparation helps you optimize the wound environment by removing debris and necrotic or non-viable tissue, reducing malodor and exudate associated with tissue breakdown, reducing bacterial load, preventing biofilm activity in the wound. Effective wound bed preparation is so important because it is clinically proven to speed up wound healing. Wound preparation includes cleansing and debridement, where you prepare all areas of the wound and the skin for healing. By cleansing the wound, you actively remove loose surface contaminants, debris, excess exudate, bacteria, and remnants of previous dressings from the wound's surface and its surrounding skin. Some experts consider that only gently cleansing is required to avoid disrupting newly formed granulation tissue. However, chronic or hard-to-heal wounds with devitalized tissue or suspected biofilm require more vigorous therapeutic cleansing. When a local infection is present in the wound, you can consider using a cleansing agent with antimicrobial properties. By debriding the wound, you remove adherent non-viable or devitalized tissue, such as slough and necrosis-infected tissue and biofilm, foreign material and debris from a wound bed. The debridement method should always be determined by the patient's clinical need and available debridement choices. Your patient's experienced pain level will guide you how much you can debride the wound. To debride or not to debride. There are relatively few wounds where it is not safe to debride if a correct method is chosen. As a general rule, if the wound is not covered in granulation tissue, debridement can be performed to help the wound heal. You might need to be extra cautious with high-risk areas: face, hands, feet, and genitalia. Ischemic limbs, such as diabetic foot ulcers. Wounds in patients with blood clotting disorders. Remember, it is important that you recognize your own limitations and refer the patient to the most appropriate specialist if you lack required skills and tools to perform debridement. Wound preparation should be routine and regular. It is not an occasional and a desirable option. Remember, you have to prepare the wound bed, wound edge, and peri-wound skin at every dressing change. To wrap up, wound preparation is clinically proven to speed up wound healing. It should be a routine and regular practice at every dressing change. Most wounds are safe to debride if a correct method is chosen.